I've long argued, Taoiseach, that I would have preferred to have seen less restrictions on general society and the economy generally, and more targeted interventions. And one area that in particular needed targeted interventions, and in fairness your government provided, were nursing homes. And your government provided the TAP, the Temporary Assistance Payment Scheme for nursing homes. But we learn that in conjunction with these measures that you're announcing, simultaneously you're taking away that temporary assistance to nursing homes. Now, it is temporary, and I accept that, but it is essential, because the threat in general hasn't subsided, but in particular the threat hasn't subsided in respect of nursing homes. Because we know the congregated settings, be it a direct provision centre in Ennis, where there was an outbreak last week, or meat factories, where there's a continuing where there are continuing risks and continuing outbreaks, or indeed nursing homes. In your own city of Cork, there's been an outbreak very recently in Marymount Nursing Home, notwithstanding the fact that all of the staff and all of the residents are vaccinated. So continuing measures are necessary in nursing homes and in congregated settings more generally. And if that will not be funded through the TAPS scheme, how will it be funded?
And I think what we're seeing here, Deputy, and essentially is we are into a different phase now of the pandemic as we speak. I mean, the vaccination programme is having an impact, so therefore there are consequences to that too, in terms of moving forward and allocating resources in a more targeted manner. But again, we will be there in terms of supporting nursing homes. At the time of the introduction of TAPS, things were in a far different position in our nursing homes in respect of COVID-19. The outbreaks that were occurring are no longer occurring.
You say there will be supports, and I'm told that nursing homes who have contacted ministers in your government have been told that if there's an outbreak, that monies will be made available. But Taoiseach, the point of all of this is to avoid outbreaks, and in particular to avoid outbreaks in congregated settings. And notwithstanding the high take-up of vaccines, there are still, unfortunately, outbreaks. They're fewer, the consequences are less, I accept, but we need to avoid the outbreaks and the consequences of them. And you talked about lessons being learned. Taoiseach, we are going to have to look at the spread of COVID-19 in healthcare settings and in congregated settings. And I think a tribunal will have to be looked at, in particular to look at the earlier deaths in nursing homes and whether people were sent home or sent into nursing homes from acute hospitals with COVID at the start. But my question is, how are nursing homes going to fund the measures that continue? Because
Thank you, Deputy.
Yes, the risk is less, but it is still greatest among a certain cohort.
Thank you very much,
and
Taoiseach.
that needs to be funded.
Well, first of all, the supports have been very extensive. That needs to be said, because very quickly they get sort of read into the narrative and taken for granted. They've been exceptional supports because the pandemic has created the need for exceptional supports. But as we get situations under control, the same level of supports won't be sustainable in many areas. But what we can do is work to support nursing homes in the event of any outbreaks, for example, that there would be assistance available to a nursing home in an outbreak situation. And I think the vaccination programme has had a very significant impact in bringing the situation under control within nursing homes.